Let's talk about nasal valves. The first one is the internal nasal valve. So this is going to be located between the septum and the upper lateral or outside cartilage. The external nasal valve is going to be formed by the soft tissue and cartilage on the outside where the nasal opening is. The internal nasal valve in particular is actually going to contribute 50 to 75% of the nasal resistance. So they prevent nasal collapse. So when we inhale, we need to make sure that our nasal valves are open, which is what we're going to touch on today. And so if we have collapse, it's going to greatly reduce airflow. They're going to help direct airflow in the correct channels, which is ultimately going to help with smell, so our olfaction. It's also going to help with humidifying the air and also filtering the air. And then lastly, it is going to impact your breathing efficiency. So if we have a nasal valve collapse, internal and or external, this is going to be a nasal obstruction, which is going to contribute to mechanical issues that contributes to things like mouth breathing, snoring, sleep apnea, upper airway resistance, and many other conditions. This is often missed in airway screens and assessment, and it is so important and it is so basic, so we're going to go through it today. Okay, so here's the first test. You're going to take a quick inhale through the nose and you're going to see if both or one of your nasal valves externally right around this nasal passage collapses. So you can see how both of mine are doing that. They're going in a little bit more on the left side. Okay, so that's going to test for an external nasal valve collapse. Now we're going to do an internal nasal valve collapse. So you're going to go right here on the outside of the nose like this. You're going to pull apart. You're going to breathe in, breathe out. If it feels way easier, then you know that you have an internal nasal valve collapse. If you're not sure, what I always recommend is a follow-up to that. So do one side at a time. So mostly breathe in on this left side, mostly breathe in on this right side so that you can test individually. Then you know if you have one or both of these collapses.